session. Stacie is going to be providing us with some tools, AI prompts, and some practical advice on how to approach employee well-being. So without any more delay, please join me in welcoming Stacie Baird. Over to you, Stacie.
Thank you, Miriam. I'm going to try to drive, y'all. Like, technology is my friend today. At least that's what I'm saying. So thanks for joining me. We're going to, in this session, and I listened to the last session, which was really incredible, trying to integrate a lot of what was discussed in the last session, which is practical ways that you can start dipping your toe in this stuff, in AI, in this particular application related to employee well-being and mental health. So this is really a humanist approach to how to leverage the technology, which was discussed quite a bit in the last session. And how we start to do that is how we get comfortable is by doing in many cases. So I'm going to walk through this, this session, and hopefully you guys will find it helpful. So a little bit about me, like Miriam said, I have two roles. One is I am a chief people officer for a mental health organization that has national reach. We treat opioid and substance use disorder. So as you can imagine, our employee population has really heavy, hard lifts every day working with people struggling with opioid use disorder, which is an epidemic in this country, as many of you know. And we have to work really hard as an employee experience team to help our team help themselves have really strong employee well-being and mental health. And so that's part of my world. My other part of my world is I have a podcast, and I've done it for 5 years. I do it to continue to learn. So I do it to share what I'm learning so I can share with my team and share with those people like you out there what I'm learning about the intersection of, for example, the humanist approach to implementing AI as a good example in this case. So that's a little bit about me. What are we going to cover today? We're going to talk a little bit about where employee well-being is, why the work is inside out, how do we integrate tech and specifically AI, and then we're going to work to build a toolkit today. Don't have a ton of time, but we have some time. Miriam, how much time do we have from now, just so I can set my watch?
We can go for 20 minutes as we had decided.
Okay.
Yeah.
Perfect. I just wanted to verify. So I want to give you guys something to walk away with. I think that's really important. So I want to help you build a toolkit walking out of here where you can immediately apply some of these learnings. We're going to try to be incredibly interactive today and have a lot of polls because I want to hear from you guys as we go. So my first question is, how many of you are expecting an increase in healthcare premium in 2025? So if you can just answer yes or no about what your thoughts are on that. And the reason I asked that question is 95% of you are saying yes. And that is what we're hearing across the board. So why is this conversation today really important? Health insurance and employee benefits is the largest expense in most organizations related to the people space. And mental health continues to trend as an overall healthcare expense, outpacing overall healthcare by 52%. You can read this slide. So why is it important? Lots of reasons here. But for example, an evidence in our business is opioid treatment has a lot of stigma. And so one thing that we talk a lot about is reducing the stigma of employee mental health and well-being inside of your organizations. So I'll give you an example of this. Any of you who are familiar with overdose, we talk about this a lot. There's even stigma for people carrying, as an employer, Narcan. And does that enable drug abuse? The answer is the only thing that Narcan, which is a life-saving medication for somebody who's having an overdose, the only thing that Narcan enables is someone breathing. So we do a lot of work in this space on reducing the stigma of looking and seeking for help in the mental health space. So that's one of the reasons I'm incredibly passionate about this. In addition to, like I said, costs a lot of money. So where do we start? We have a lot of intersections related to well-being. So we look at the data. We know that there's physical, emotional, and social well-beings. There's lots of different programs you can look at. Remote work has made this even more complicated than it was before. There's a team intersection here about social and emotional well-being. And today we're going to talk a lot about this is inside out work. So mental health and well-being in general starts with, and I'm going to challenge each of you that are in the seat of being and leading HR teams, this work starts with you. It starts with you and your team. And we're going to talk about how to lead by example today and how to help your teams have greater well-being and for yourself. But first, I'm going to start with a little bit of a story as to why I think this is so important. So in January of 2023, it was officially my 25 years, if you can believe this, in doing this stuff for a living. I've been a chief in this space now for over 15 years. And this beautiful human being here that is with me in this photograph is my daughter. We have 5 children. This is my middle daughter, so she's second to youngest. Her name is Jocelyn, and in January of 2023, we were at the pediatrician's office, and she was not feeling well. And in the matter of 24 hours, she was diagnosed and started chemotherapy for a very aggressive form of childhood leukemia. She was 17 at the time. And I'll tell you guys, I really thought I understood employee well-being and mental health. I thought I understood boundaries. I thought I understood what it meant to be in the human resources function and to have overall well-being. And in the next 12 months, through 30 days of inpatient procedures and 1 year of everyday chemotherapy for her 5 days a week, I learned I didn't know what I thought I knew. And so I'm sharing this with you from a space of having my world rocked, that I almost lost one of my children. And over the next year, we had to figure out how to find this space. And I started sharing this with my team and across my organization. So that is the why behind why this is so important. So I'm going to use this as a metaphor throughout our conversation today of how you can start to make decisions and choices every day to lead by example, and then how you can teach your leadership team to do the same thing. And then how do we integrate technology and AI to do this a little bit better? The first 30 days of Jocelyn's treatment, I had big choices to make every single day. And so I had about a 45-minute drive to the hospital. I went every single day. Of course, some days I stayed overnight, but that wasn't good for my well-being. She was in a hospital room hooked up to lots of machines. So I needed my sleep as well. And I started to understand and read a lot more about boundaries, self-compassion, and self-awareness during this time. I had 45 minutes in the car, and I started listening to and consuming everything I possibly could of how the hell was I going to make it through this journey? How was I going to be an executive, chief human resources officer, be a mom to 5 kids, have a child in treatment, be a wife, be a friend, be a daughter? How was I going to do all of that and hold myself together? So I started listening to the work of Chris Germer and Kristen Neff around self-compassion. And what I recognized was this powerful practice of self-compassion gave me a million choices a day. And one really specific example comes to mind of when I got to the hospital every day, I had to make a choice and a decision. If you look at that map at the top, that's the hospital. There's a huge parking garage. I could choose to drive into the parking garage. And if you've never been in a children's hospital, guys, people are not there because their kids are well. People are only at a children's hospital because their kids are sick. So if you can imagine a parking garage of frustrated, exhausted parents with kiddos that are not well, that is a pressure cooker of a situation every single day. And across the street, there was a Starbucks with a Starbucks parking lot. And so I started with a very simple exercise of self-compassion, and I'm going to walk you through these steps. The process is I had to make a choice of how was I going to show up for this beautiful human that's in her little dinosaur blanket here, how was I going to show up for her in the most powerful way? And did that mean that I took a right-hand turn and I parked at Starbucks and walked across the street and took some space before I walked into her room? Or did I have the strength that day to park in the parking garage, and maybe I wanted to have a different experience that day and look out across the rooftops and take a deep breath up top? So I use this as an example because I got a lot of practice. I did this every single day for the 30 days she was inpatient. I had to make this choice. And this is what started me down the road of understanding that these are choices and decisions that we don't mindfully make throughout our entire day. So today, flash forward, I'll spoiler alert, this is Joss now. She is about to graduate from high school. She's 18. This is her senior picture. She's doing amazing. And she learned so much, and so did the rest of us through this journey. And she is doing awesome. She actually is starting school in 2 months to be a nurse. So this changed the trajectory of her life in so many ways, but it also changed the trajectory of my career and what I think is important now. So let's talk a little bit about self-compassion. Let me ask you a question. This is a poll question. What % of the time do you mindfully ask yourself, what do I need right now? So answer that question if you would. So I'm guessing, I can't see the results yet, but I'm guessing, yeah, sometimes and never, right? So the reason why this is important is there's a 3-step process that is based in evidence-based neuroscience that is the best off-ramp for all the things that we've been talking about for the past 4 years since COVID: burnout, fatigue, and overwhelm. This 3-step process, and again, free resources, happy to share any of these resources. This is not my work. This is the work of Kristen Neff and Chris Germer. This is a 3-step process that anyone can do anytime. So number 1, do you know when to pause? So when you feel anxiety and stress in your body, when you have symptoms of burnout, or when you feel like you're about to break, do you stop? Number 2, second step is to normalize. Let me use the parking garage. It is normal for me to feel overwhelmed and scared. It is normal for me to not want to park in a stressful situation today because the commute in was really tough already, and I need to show up for Joss. So I'm going to park at the Starbucks. I'm going to get her a Frappuccino, and I'm going to get me a coffee, and I'm going to walk in the sunshine across the street. It's expected that I would feel that way. This is hard. Number 3, what do I need right now? What would I tell a friend? And what would feel best for me? So if I was talking to a friend instead of myself, I would probably say, hey, be gentle with yourself. This is hard. Go get the coffee if that feels good, and don't park in the parking garage today. Or park in the parking garage and take a deep breath upstairs. Just pause on that rooftop and decide how you're going to walk in to the next step of this journey this morning. So why is this important, and why does this matter? I know trauma is a big word, and everybody uses the word trauma in a lot of different ways. It actually has a lot of different meanings. Since my time in this journey, I have been doing work with the Trauma Institute of Arizona, and they are an accredited body around trauma work. So my first question around trauma is, have you ever experienced trauma at work? What do you think? Yes or no? 89%. Well, self-awareness, y'all, is the first step. So let's talk a little bit. I'm glad everybody felt like this is possible, right? Let's talk about different types of trauma, very specifically one that affects those of us and all of your teams in the practice of human resources, and is very common in helper-related jobs, and that is vicarious trauma. So you can read the definition here, but this has to do with empathy fatigue, secondary trauma, vicarious distress, and caretaker burnout. So for me, I was experiencing this in two ways last year. I was a caretaker to a child who had cancer, who had chemotherapy every day. So not only was I caretaking for her, but I was around children every day who were anywhere between 18 months and 18 years old, struggling with cancer. That in and of itself was vicarious trauma. I was learning about the stories of other patients and the struggles that they were having. But I want you to think about this related to your work and your team. How often have you ever terminated someone, helped somebody navigate illness and leave, or taken a call from someone who needs to go on bereavement leave and just lost a loved one? Vicarious trauma is the human experience of HR. And so the reason I started talking about this is I recognized for the first 25 years of my career, I never gave myself permission to take space. So how many times have any of you had a termination conversation with someone and then jumped right to the next meeting? Did you take some of the steps we already talked about in pausing, in self-regulating, and asking yourself the question, is that part of your process? Do you give your teams permission to take that space? Do you normalize, and I heard about on the last session, normalizing the use of AI through doing it yourself and doing it as a group? Guys, what I realized is, as the chief people officer of a mental health organization, if I didn't give myself permission, no one else had permission to do this either. So I'm going to talk you through how then do we leverage technology and specifically AI tools to start to do this work. And you don't need to buy anything. You don't need to spend any budget to do this. This is simple stuff that we can all do every single day. So number one, the first step in self-compassion is self-regulation. And let me talk a bit about this. So starting to identify options on how to self-regulate is the best place to start. There are hundreds of ways to self-regulate your mind and your body when you experience stress. And we're going to talk a little bit about that. The second is to practice, rinse and repeat. And hey, we can use technology here because we can set reminders to do this every single day on our calendars or on our phones. Technology is your friend here. Use it to set reminders on practicing self-regulation techniques. Let me give you an example. You have a termination discussion coming up or a challenging employee relation conversation coming up with someone on your calendar. Give yourself 10 minutes after, and we're going to talk about how you can find this stuff via AI. Give yourself a link there with some of these prompts I'm going to talk about on how you can leverage AI in that moment to self-regulate. And finally, one powerful one, and I'm going to talk about freedom Friday in a moment, reflect. What we know about habits and human behavior is we don't change our behavior because we cognitively know it's better for us. We change our behavior. This is Atomic Habits here, guys, if you haven't read James Clear's book. So this is his work, that we know people change the grooves in their brain and their habits because you connect back. And so set a Friday reminder to reflect on when you did those self-regulation techniques throughout the week. How did you feel and how did the rest of your day go or the rest of your week go? That's what's going to start to integrate this into your habit stack and behavior. So how do we do that? How do we use AI and how do we lead by example in using AI? As many of the panelists said on the last conversation, this is really about trying things out and seeing what works. So I'm going to give you 3 prompts as good examples that you can share with your team and your leadership team as examples. And it's really about developing language around mental health and well-being that helps us be better at this, because using appropriate language in the prompts are going to get you the best result on the other side of AI. So for example, let's say you have the prompt, what is one step I can take to feel less anxious right now? And you can just put that in any of these generative AI tools. Number 2, let's say you have a big meeting coming up, and you need to upregulate. That means you need to get psyched up. Like, I taught fitness for 20 years. So that was like having a hype song in the very beginning. And so I would play that hype song to get myself mentally ready. There are breathing techniques and other things you can do. So that's a prompt that you can use. If you have a big something coming up, you're going to present at a meeting, how can you upregulate yourself? The last one is simple. Again, let's say you're feeling stress in your body. How can I down-regulate myself from my desk right now? AI is going to give you lots of examples and things that you can do immediately to start to feel differently in your body, to self-regulate back to a place where you can enter the next room and the next space with the best energy you can. Because as a reminder, you are responsible for the energy you bring into a space. No one else is. So let me talk about another tool that I use. And May of 2022, I started here at Community Medical Services as the Chief People Officer. And let me tell you guys, it is a very emotionally charged environment. We work with people having their hardest day ever, every single day. People that are detoxing off of opioids, off of fentanyl. As you can imagine, that creates emotional charge. And compound that with, we have an incredibly flat organization. We have about 1,000 employees in over 75 sites. And every Friday, you heard me correctly, we do a town hall every Friday. It's an open forum. And what I started to realize is, after a long week of this emotional volatility, how the heck was I going to get on a call on Friday and be emotionally available? So I started asking myself what I needed. And what came out of that was, I normally work out really hard every single day. That's not what I needed sometimes to be emotionally available on town hall on Friday. So that's one thing that I would suggest you do. Get to Friday and set a reminder. What do you need to show up that day? What do you need to close the door on for your weekend? That is mental health and well-being, and that's leading by example. Another option, count your gains and then reflect on your strategies. Those are all things that are here that you can, again, use AI to guide. So what do you do right now? Let me ask you a question. Last question today. Do you feel a little bit overwhelmed about the thought of using AI? What do you guys think? This may have been asked before, but I'll ask it again. Most people in the HR space, and I'm speaking about this topic on my podcast and everywhere else, are saying, yes, feels really overwhelming, right? We need to know everything a mile wide and a mile deep lately. We need to know everything about mental health and well-being, all the way to technology, all the way to drive down benefits costs and reduce turnover and increase employee engagement. It's just so much. How do we do it? Number one, get educated. We're the humanists. HR should be the humanists at the table. I heard Brene Brown speak, and she said this is the time. Be the humanist in the conversation, but that requires you to get comfortable with the technology and the terminology. Do bite-sized pieces. Follow practitioners out there. Again, some of the people on the panel, follow them. They're doing this work every single day. Start with some of the simple tools. Again, Microsoft Copilot, whatever it is, just type in some of these prompts and try it. Do it in front of your team, as some of the last panelists said. Finally, here are some AI generative tools that are specifically, if you're ready for 2.0, you can use some of these things that are generative AI based that can help you increase your employee health and well-being by starting with yourself. I use Calm. It takes you through a 3-step process to identify what meditation might be best for you to downregulate or upregulate that day. Same thing with Headspace or Aura. And then Insight Timer gives you some options. So I know we're at time, but I just wanted to give you a few toolkits. Take this with you, take these prompts with you, try them in front of your teams and with your teams on your next team meeting, and get people to start to be comfortable working in the space of the intersection of employee well-being and the humanizing the experience with the technology. That's right where we're sitting, guys. That's the right now of human resources. So I'll take any questions if there are any. Happy to also, if you want to find me, I'm on LinkedIn, of course, Instagram. Podcast is syndicated on all major channels. And also, you can find me on my website, just staciebaird.com. So you can find out where I'm speaking, what I'm speaking about, but speaking a lot about this topic right now because it's so prevalent as part of our conversation.
All right. Thank you so much, Stacie, for sharing all your truly inspiring insights on this topic. In the world of work, we do often tend to ignore the human aspect, no matter which role you're in, and it becomes all about the numbers, targets. So it's extremely refreshing for someone to come in and say, hey, you really need to take care of yourself first, especially for HRs who are tasked to support employees in a lot of different ways. So I think this was a really uplifting way to conclude this session. So thank you again, Stacie.
Absolutely. Grateful. Thank you.